Hey,
Hey,
Leanne.
folks. Hi, I'm Leanne Palmerston.
And I am
Hi, how
Megan.
you doing?
Oh, Leanne, you're lagging, so I keep talking over you. There we go. Hopefully it'll all.
Sorry.
All right, let's try that again. I am Meaghan Grant, and I will not talk over Leanne anymore.
I'm Leanne Palmerston from Hamilton Family Doulas, and welcome to this week's Birth and Baby Talk.
I am so excited. It's actually been like a few weeks since I got to do one of these talks. So I'm happy. I mean, and the last time I was literally laying it bare all over a pelvic floor physiotherapist table. So this week is a little bit different. I am not in somebody else's office. I get to be in my own this week. And this is a topic that, despite the fact I had my babies young, and Leanne, I think you were on the younger side too, this whole topic fascinates me and drives me up the wall at the same time. And I'm talking about pregnancy over the age of 35. What is now generally referred to as advanced maternal age or late maternal age, used to be called geriatric pregnancy, and I will maintain to my dying day that a man had to have come up with that phrase because no woman would do that to another woman. And it's an awful phrase, and there's a lot of misinformation about this. There's this idea out there, Leanne, I'm sure you've encountered it, that like 35 and the statistics are terrible, and there's no.
Yeah, I did have a pregnancy when I was 36. My youngest was born when I was 36, and it did say geriatric pregnancy on the board on the wall. It's strange that they use that term, since there's nothing geriatric about a woman in her late 30s and early 40s. Like advanced maternal age I could live with, but not geriatric.
Yeah, I mean, and from what I could tell, geriatric has always been the one that really bugged me. And from what I could tell when I was doing a little bit more like, what are the current statistics research for today? It seems that phrase has fallen out of favor in most medical circles. Now, Leanne, you and I both know that just because something has fallen out of favor doesn't mean that specific individuals have stopped using, or even hospital systems have stopped using that phrase, but the literature now tends to skew towards advanced or late maternal age, which is slightly better. But even then, there's still this idea that you turn 35 and all of a sudden everything is far more dangerous, everything is scarier, it's a high-risk pregnancy, and that's not necessarily the case. Now, obviously, there are things that are a little bit different with a pregnancy after 35. There are a few things that people need to be aware of. There's things that people can do to prepare a bit more ahead of time. Specifically, after 35, you really want to make sure you're taking your folic acid supplements at least 3 months before trying to conceive. That is a big one for the post-35 crowd. So if anyone out there is trying to conceive and you are not already on your folic acid supplements, hit Amazon Prime or your drugstore or whatever, and make sure you get those and you get them on board, because that is, one of the things we know, and the statistic that everybody talks about is the increase in trisomy diagnoses like Down syndrome in the after 35 crowd. That said, it's like, do we all remember like grade 9 math where you learned like the graphing up, and you don't suddenly go exponentially up in terms of risk. You're not 34 years and 364 days old and everything is healthy, and then you're 35 years old exactly and suddenly things are dangerous. So you do sort of see this increase. Where, from what I can see in my research, where doctors really start to get more, I'll say, on people, is after 40. The 35 to 40 crowd, particularly in people who don't have any underlying health conditions, that is something we see more in women who are in their late 30s, especially in Canada. Autoimmune numbers for women in their late 30s in Canada is rather high. So we definitely see underlying health conditions, and that can change the health of a pregnancy. But assuming a healthy individual who is pregnant between 35 and 40, your numbers increase in terms of risk, but slowly. And the sort of top that we look for are obviously an increase in genetic abnormalities. This is why the additional genetic testing is offered under OHIP for people in Ontario over 35. Obviously, that sort of informs the care of your pregnancy if you need additional tests like a chorioamniocentesis, that sort of thing. But then we also start looking at sort of linked concerns. And this is where, I mean, Leanne, you and I can get into talking about placentas all day, every day, but I'm not sure everybody else wants to talk about placentas that much. But a lot of the concerns that come along with late pregnancy or late stage pregnancy are these sort of placenta related issues. Placenta previa rates are a lot higher after 35. So we see sort of misplacement of the placenta. We also see the higher rates of things like gestational diabetes, which is again, a placenta-linked hormone sort of driven condition. This is why we also see it higher in twins. And for those who are 35 plus, that does go up quite a bit after 35.
Yeah, it's like your ovaries suddenly start spitting out doubles and triples just to see what sticks.
So, and actually, Leanne, that's probably a good point to make, that I think this is one of those like basic genetics and anatomy things that not everybody realizes. Women, uterus havers, you are born with your entire lifetime store of eggs at birth. You develop those while you are in the womb, and that is the lifetime supply of eggs. And you begin ovulating usually in your early teens, maybe your tweens, and you ovulate for roughly 30 to 40 years, depending on when you hit menopause. But around 35, your ovarian reserve, this is what it's called, starts to decrease. And your body's response to that is apparently to make it decrease faster. So this is where Leanne is talking about. Your ovaries actually start dropping multiple eggs. And this is where fraternal twins and other higher order multiples come from. And this is why after 35, your rates of multiples increase. The more babies you're carrying, the higher your other risks. Placenta previa, gestational diabetes, preeclampsia. The more placentas there are, the more risk for those sort of placenta-related conditions. And so that definitely goes up.
And additionally, we also see the numbers of families who are proactively seeking fertility assistance start to rise in their mid-30s and into their 40s. And of course, that when we're hyperstimulating the ovaries or we're implanting 2 to 3 viable blastocysts, I think they're called, but viable babies, when we're implanting those for assisted fertility, the chances of all implanted embryos taking is pretty good. So we're seeing it on multiple fronts here.
Well, and we're seeing an increase in that use of reproductive technology, in part because people are waiting longer to have their first babies. Now, one of the most interesting things for people to be aware of, most of the statistics apply predominantly to people who are having their first baby after 35. If you are having subsequent babies after 35, there's a slight increase in risk, but it seems to be dramatically lower than if it's your first baby. So that's definitely something to be aware of. So those of you who are on your second or third or whatever baby this is for you, you may skate by with fewer of the sort of catastrophizing conversations with care providers about your age. And I will say, I've definitely seen some catastrophizing with clients, Leanne. I'm sure you have over the years too, where doctors are trotting out these really scary statistics. And, most people don't think of gestational diabetes as a scary statistic, which is good because it's not. But it is a factor, and it's a factor that sort of carries through your pregnancy. Does that mean an induction? Earlier in the process, are you going to have more monitoring? What does that look like for you? But then the really scary statistic they trot out is stillbirth. And I'm sure you've seen this, Leanne, and I'm sure anyone who is watching this who is over 35 has read or seen this statistic, which is women who are 35 plus are as likely to have a stillbirth at 39 weeks as a 20 to 34-year-old is at 41 weeks. So for those in the GTA, we often see day 10, post 8 being the day, OBs want inductions to start happening. That's that 41-week mark that they want to beat. With especially Primex, which is a first-time parent, first-time pregnant person who are having a baby after 35, we do definitely see recommendations for inductions at a much earlier point than we do under 35. And there are obviously reasons for that statistic. We definitely do see an increase in stillbirth. That being said, this is where people don't always sort of recognize the limitations of statistics. It's a higher percentage, but the absolute risk is still very, very low. So higher, but it's still only 2 in every 1,000 births. So this is a very, very small number. Being over 35 does not automatically mean there is going to be a problem with your pregnancy. And I think one of the biggest things that people should do or should try and do is sort of approach these pregnancies from a preventative medicine sort of point of view. You want to get as far into your pregnancy as healthy as possible. That's always the goal for any pregnancy. It's a little bit more important when you've got other factors coming into play. So I mentioned earlier, you want to be taking your folic acid as early as possible. If you get pregnant without being on it, make sure as soon as you get that positive test, that's something you add into your daily regimen. You obviously also want to be taking your prenatal vitamins. Now, this is a thing that drives me nuts about prenatals, just so everybody knows. Iron and calcium cancel each other out, which means the iron and calcium in your prenatal vitamins are totally useless, and you need to be taking additional supplements at other times, not together. So that piece, and anemia is actually a much higher risk factor in pregnancy after 35. So that iron is something you really want to be aware of and be on top of. Low iron in pregnancy can actually cause a lot of problems, including way more of those ugly, like nausea, morning sickness, exhaustion, symptoms. Obviously, we all want to get rid of those as fast as possible. Making sure your iron levels are good is part of that. The other thing you want to do, I will admit, I spent the first trimester of my pregnancy like on a couch eating saltine crackers and mangoes because that was the only thing I could keep down. And I was like, yeah, no, I'm not moving. I'll see you in 3 months. But obviously, light, regular exercise is really good and important in pregnancy for everyone. More important when you are over 35. Again, you're trying to maintain that cardio health and the muscle mass. All of that is going to help you have a healthier pregnancy and is going to help you when you're giving birth as well. Now, some people run marathons in their late 30s. I am not one of them, but those of you who are much more energetic than me and Leanne, because Leanne and I are not the marathon type, you can keep doing what you're doing. The general rule when it comes to exercise in pregnancy is don't start anything new. Everybody walks, or most people walk. And if walking is a thing that you are capable of doing, then that is sort of the baseline of exercise. If you, and actually I lied. My first pregnancy, I was really, really good about exercising. Second pregnancy, I lay on the couch. My first pregnancy, I went to 6 a.m. spin classes for my first 2 trimesters. But it was totally fine for me to continue doing that. And it was cleared with my OB because it was something I had been doing for over a year prior to becoming pregnant. My body was used to the exercise. It helped me feel better to continue doing that. As long as you are cleared for exercise, and I mentioned earlier, placenta previa, which is where your placenta is actually too close to the cervix, is a higher, more common issue in pregnancy after 35. If you have placenta previa, you are going to be put on pelvic rest, which usually means no exercise. So always double check with your OB or your midwife or your family doctor before you embark on sort of major exercise. But know that for the most part, exercise is totally fine in pregnancy as long as you're listening to your body and it's something your body is fairly used to. The other one that's super helpful for lots of people is prenatal yoga. But there's all kinds of light prenatal exercise classes that are available out there. 1,000,001 years ago, I think I did a blog on this. I'd have to look and see if I can find it again, of some of the best prenatal and postpartum workouts in the GTA. But you want to keep your body moving. You want to keep it active. This is especially true if you have underlying health conditions. And unfortunately for all of us, underlying health conditions in pregnancy over 35 include BMI. And Leanne, you and I, I'm sure, can do a rant another day on BMI and the problems in applying BMI in pregnancy and all of those issues, but it is something that is factored in. The other thing that I'm going to say, and this may sound like a little bit of a plug for doulas, but I'm actually plugging everybody else more. Bring in allied health professionals much earlier in the process. I always recommend my clients go for pelvic floor physiotherapy, massage, that sort of thing. But in the over 35 crowd, you really, if you don't have those things sort of lined up and ready to go, start looking into them, get them organized. I am now 30, almost 35, and I can tell you my body is so not the same as it was 10 years ago. I don't sleep as well as I used to. I mean, I get more sleep sometimes, but like I don't sleep as well, and my joints creak, and like you get up off the couch and your whole body goes snap, crackle, pop. Not quite the same as when you're 25. So bringing in those other health professionals at an earlier point can actually help sort of maintain that balance within your body of good health for much longer. And you can sort of stave off some of those really common pregnancy, I'll say complaints, legitimate complaints, lower back pain, your center of gravity being off, your hips hurting, carpal tunnel hands is a lot more common after 35. And often that's because we're sitting at our desks typing a lot more at 35. You know, we're further into our careers, so a carpal tunnel is really, really common. All of these are things that can be addressed with a physiotherapist, a nutritionist or a dietitian, your chiropractor, your massage therapist, a pelvic floor physiotherapist, because all of that pelvic floor, you want it to be as strong and as ready to go as possible before you have a baby, especially because cesarean rates are higher in people over 35. Now, is this because of induction rates being higher? Possibly. There is definitely a correlation. Not that Born is particularly eager to hand out statistics to more people. Born, for those who don't know, is the Ontario registry. Sorry, everybody. I'm in the middle of something. Virtual schooling is fun. Yes, I can charge your laptop when I'm done. Welcome, folks, to 2020 and what it is like to have your kids home. Their father is all the way in the basement and could have easily answered questions.
Kids.
So, you know, you really want to sort of prep your body to be in the most sort of, I'll say, peak physical condition, which is different for everybody. But you really want to avoid as many of those sort of complaints and concerns and complications as long as you can and as much as you can. Bringing in those other professionals beyond just your medical care provider gives you sort of a lot of different options in terms of ways of managing discomfort or other symptoms. And I often sort of will recommend other things. A really great, you know, pelvic floor physiotherapist might know someone who specializes in carpal tunnel issues if you have that as well, and can sort of give you those names and referrals. A lot of these professionals work very closely. You know, my chiropractor works in a physiotherapy clinic, so the whole team is integrated. So you can often find those professionals, and you do and you don't want to look for people who specialize in pregnancy. If you have a care provider that you absolutely love and you have been seeing for years, and they're comfortable treating you during pregnancy, far better to stick with who and what you know than to go looking for a chiropractor, especially who is, you know, knows Webster technique and is sort of prenatally specializing. I did that. We still joke about this. I'm 8 weeks pregnant. Can you still treat me? And he was like, yes, I can still treat you. And he's now been treating me for 8 years. So, you know, obviously I've stuck with what I know and with what I like. And with what's effective. Massage is the same. When you find a massage therapist that is the best for you, you stick with that person as long as they understand prenatal massage. All of them have training in it, but that doesn't mean that everybody continues to practice it and is comfortable with it 10 years at a massage college. Yeah. So, make sure that your care practitioners are comfortable continuing to treat you. If not, they will have somebody to refer you on to who specializes, guaranteed. You are not their first pregnant patient. But really, finding these people can help you sort of set yourself up for that sort of healthy pregnancy. The other thing to know is it is more common to give birth earlier, before 40 weeks. Even if you don't go into into labor spontaneously, they are looking to induce around 39 weeks. So consider starting your mat leave earlier. Those of you who are the work up until my due date, I am going to call out the lawyers and the doctors and the accountants in April, and all of you who know exactly what I'm talking about, who are like, I'm going to wait until the very last minute, and then they go into labor and things are left undone on their desk. Yeah, I'm talking to all of you. My husband's a lawyer. I have seen this play out time and time again. I always ask when their last day of work is, and their baby is always born the next day. Because they go off of work and everything relaxes and boom, there's a baby. But you want to think about starting your mat leave a little bit earlier. Chances are your body, especially the closer you get to 45 than 35, the more uncomfortable you're going to be at the end of your pregnancy, the more edema and swelling you're going to see in your joints, the more likely it is that your doctors are going to want more frequent appointments and ultrasounds and testing and monitoring and all of that. The more likely it is something is going to change quickly and you need to go and get seen and potentially sort of move into a birth or induction scenario very quickly. So having all of that stuff wrapped up, the last thing you want to do is go into a labor where it already says geriatric pregnancy across the whiteboard in the front hall. And so that is the sort of mentality care providers are coming in with. And in the back of your mind, you know that massive file that you need to transfer to your colleague is left undone, and now you're in labor, and how are you going to manage that?
Yeah, I strongly recommend folks, like, if you are working in a sort of corporate environment where you're sort of project-based working or you're working on big things, get that shit wrapped up by 36 weeks.
Yes.
And then you have the opportunity to continue to work, but on less vital kind of stuff, less important stuff, or things that are really easy. Because I can tell you from firsthand experience that being 36 weeks and not being prepared and having your water break at work and desperately trying to finish up just enough information so your mat leave replacement knows how to log into all the things on your computer. Yeah, that's important.
But it's true, and it is a stressor, and we do know that stress can trigger other complications. So we do sort of want to manage all of that stress. And actually the allied health professional I didn't mention earlier, this is true of any age in pregnancy. Therapy is good. Having a therapist is awesome. Especially right now, there's a lot of additional stresses on pregnant people. Generally speaking, no one plans to give birth and have a baby during a global pandemic. And so having somewhere to develop coping mechanisms for stress, including parent and pregnancy related stresses, is a really, really good step. Obviously, I'm going to encourage it even more for the 35 plus crowd, because you do have more people fear-mongering with you or giving you scary statistics. You do have additional factors to think about. And also, I mean, at 30, in my mid to late 30s now, I'm kind of like, I am happy with getting full nights of sleep. And, so there's a big life change coming up that's a little bit harder, I think, to adjust to in your 30s than in your 20s. So, having someone to talk to, setting up those systems early is also going to be beneficial. From a really practical point of view, get your pregnancy pillow and your pregnancy support belt and all of those other sort of like physical accessories way earlier in the process. Also, get your maternity pants earlier, because it's really a crime that we can't just wear maternity pants our entire adult lives. It's like wearing jeans and dress pants that are yoga pants at the same time. Like, there's literally nothing better. So, you're probably going to find discomfort happens earlier in your body. You don't want to wait until you're already in that, like, oh my gosh, what do I do? I'm in pain stage before you start looking for these solutions. So the pregnancy pillows, I particularly like the big U-shaped ones that can support both your belly and your back. This helps you prevent rolling onto your back if you're normally a back sleeper, but it will also just help give a little bit more support everywhere, generally speaking. I had a pregnancy support belt in my second pregnancy. One day we'll have to do a whole episode on sort of pelvic issues and symphysis pubis dysfunction, because that was SPD is a condition I developed. It's very painful. And a pregnancy support belt can be really helpful. Super helpful when your center of gravity starts to move forward, your lower back starts to arch a bit more. You have those discomforts. Getting those things earlier in your pregnancy is just going to be beneficial. And again, that helps us keep that comfort and pain and swelling down as long as possible into the pregnancy. The last thing I'm going to talk about, because it's really plugging us, but also just a reality of having a baby later in life, is sleep is a real factor once your baby is born. I will tell you, I can't get away with all-nighters the same way I could in my 20s.
No.
Certainly not when I had my babies. And so you really...
I can tell you, like 13 years on, I can remember the difference between my first, like that, with my first child, I was 30. No, I was 32. God, see, that's how old I am. Age in general, I am geriatric apparently now. No, but so I was 32, right? Which is supposed to be like on the, not early exactly, but not advanced. And the just like being up with the baby at all hours did not seem burdensome. But then introduce like being 36 and having a brand new baby, I was so resentful sometimes of the loss of sleep in the middle of the night. Like, it was so much harder to manage. I was just so much crankier about that change. If I had someone who could come and just sort of take over, and for the, my second baby was primarily bottle fed. And so especially if I could have someone take over that night work for me so that I could get a proper sleep, it would have impacted, like the cascade of impacts would have been huge. There's there would have been less worry with mood disorders. I would have felt like I was enjoying the process during the day more. Like, there's just so much stuff about quality of life stuff, right? Like, it's just, I would have had a better quality of life if I was sleeping better when I was an old mom.
Actually, it's really funny that you brought up a couple of those points, Leanne. There was a fascinating thing that I was actually kind of surprised by a little bit when I was doing the research for today. And unsurprisingly, pregnancy in 35 plus, these individuals do actually tend to have more breastfeeding challenges after their baby is born. Now, there's a whole lot of contributing factors to that. Obviously, induction and cesarean is one of them. This can delay lactogenesis, or your milk sort of coming in. It can also cause, all of those IV fluids can cause additional swelling and edema in your body, makes it harder for baby to latch to the breast. All of those other problems, gestational diabetes, all of those things can impact milk supply and breastfeeding success. But those who have their babies after 35 actually have higher breastfeeding rates at 6 months than people under 35. My guess, and what I would say based on sort of our clients and what I've seen in my years as a doula, is that these people are more aware of their options in terms of getting support, knowing how to locate lactation consultants, having the ability to hire them, that sort of thing. And so we do actually see higher success in breastfeeding rates but we do see more problems in getting to that point. And that's something that you ran into. I had breastfeeding problems with my first, but it had nothing to do with age. And so, you know, we actually do see some of these benefits that come in that people don't like to talk about, of like higher breastfeeding success rates, people being more prepared both emotionally and financially to have a baby in their 30s. You know, I definitely would not listen to the mom shamers and the mommy guilt the same way now as I did when I was in my 20s, right? Mm-hmm. And I've talked to clients about this where they're like, if I had my baby 10 years ago, I would have listened to everything these people said and it would have freaked me out. Now, screw them. Like, I don't care what they say. I'm doing it my way. So there's a lot of benefits to having your baby at that later stage of life too, that people like to give you the scary information and not the benefits. There's a lot of benefits to having your babies later, for sure. So that's sort of where we are. Obviously, there's so much information when it comes to advanced maternal age and having a baby after 35. We really want you to like not be scared. This is not sort of the end of the world. I've had clients in their late 40s who have had happy, healthy pregnancies and given birth with no issues. So, you know, it doesn't necessarily mean that this is a terrible, frightening, scary thing, and don't let people make it out that way. If you have complications, that's, you know, it still doesn't need to be scary. It just needs to be informed. So hopefully, if anybody, I know we don't have a ton of questions today from this particular topic, but I also know that there's people probably watching who are trying to conceive or thinking about having a pregnancy in their late 30s. If there's anything we didn't cover, reach out, send us a DM. We want to hear from you. We're happy to answer those questions and provide you with those links. And I am also happy, any of the statistics I sort of mentioned today, I have the resources for. If anybody needs those, they're all from Stat Canada. So they're Canadian statistics for once. But yeah, so that's geriatric pregnancy. Terrible term, but not this scary event that sometimes the internet and Google and your doctor will make it out to be.
Thank you, Meaghan. And thanks everyone for joining us today. If you haven't signed up for our newsletter, the link, we're scrolling it, but I'm going to drop it in the comments so that you can sign up for the newsletter. You want to get in on that because every week we try to send out a printable with our newsletter, so you can get some practical, usable information that is aimed to just make your pregnancy, birth, and parenting journey better. And if you aren't subscribed to us, friend us, subscribe on YouTube. And you will always be able to find these very helpful videos. We have amazing guests who are coming up. Next week, Meaghan Bowser-Taylor from Ottawa is going to be talking about fourth trimester expectations. So what you can expect after baby arrives. We paid so much attention to the birth and surviving the birth. And then you have to bring the baby home. And those first 3 months back at home with the baby can be quite challenging. So we'll be talking about that.
Everybody plans for the wedding, but not so much for the marriage. Everybody plans for the birth and not so much for that part where you bring baby home.
Exactly. So we're going to be talking about what your expectations are and the reality. So you don't want to miss that. Thank you very much, Meaghan. I hope you have a wonderful day. Bye.